Chronic abdominal pain can have lots of causes. For many people, it can be caused by digestive disorders such as irritable bowel syndrome or Crohn's disease. For many women, the cause can be endometriosis. And for a lot of people, it can be due to surgical scar tissue. So that could be from operations such as cesarean sections or the removal of an appendix, or even from keyhole surgery. Whatever the cause of your abdominal pain, stress generally tends to make it worse. And this is because stress switches your mind and body into a different mode, which is fight or flight or survival mode. And when this happens, the connection between your brain and your gut can be lost as the vagus nerve is switched off. And the vagus nerve is the main communicator between those two parts of the body. As the vagus nerve gets switched off, then your digestion is switched off or slowed down, so that can contribute to the problem. So what can you do to help yourself? From a fascial point of view, you can use myofascial exercises and stretches to help to start to release the abdominal area, but also to stimulate your vagus nerve. Whatever exercises you do or stretches you do, always make sure that you hold the stretch or you stay in the exercise with the pressure from the balls for at least a couple of minutes to allow the fascia time to start to release and let go. Visit our website to find out more about myofascial self-help exercises, or you can visit our YouTube channel where we share lots of self-help videos.